How do I make my child to walk? I think this is a question that every parent of a cerebral palsy child have within their mind. Friends, and welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. Today, I'm going to talk to you about how to teach your child to walk if he is suffering from cerebral palsy. I know a lot of you parents out there have this goal in their mind that they want their child to walk independently. And I'm pretty sure that's also going on in your mind, and that's the reason you have read this thumbnail and clicked on this video. So, how we can ensure that our child can walk? Now, the treatment actually starts very early. So, what's the treatment, or is what we can do in order to help your child to walk as independently as possible? Now let's talk about and understand what you need to do in order to help your child to stand and walk independently. So the first thing that you need to do, as I said, start early, which means once your baby is out from NICU, make sure you give enough amount of tummy time to your baby. I always advocate tummy time so much because it's such a helpful maneuver. Make sure whenever your baby is lying on the tummy, he gets the opportunity to put weight on his hands, on his shoulders, on his knee, and thus helps him to raise his head and raise his pelvis, which is a very important activity when it comes to sitting independently, standing independently, or walking independently. The second thing that you're going to do is you are going to take the help of the reflexes that are present in the child. Just observe when your baby is small and when you hold him and try to touch his leg on the floor, he will make an attempt to move the legs as if he's trying to walk. Now, this is a typical reflex that's present in the early days of life, but gradually it fades away. But this reflex only teaches the brain to walk. Hence, I would highly recommend that if you are having a premature baby, make sure to use some time while you are holding your baby upright with supporting the neck and then making the baby to touch the foot on the floor so that he can then move the legs and try to walk. Second thing that you can do is use of another reflex which is called as rooting reflex. Now, rooting reflex is a reflex that's present in a very newborn baby, which means whenever the lips of the baby touches to any soft object, the baby will turn his head towards that side and will open the mouth. Now, we can use this reflex by making your child lie on mama's tummy, and then as the baby touches the tummy, he will feel that it is mother's nipples and would try to come towards mother and then try to drink milk. Now, this actually develops the crawling movement in your baby. Hence, it's very important that mother should spend some time by keeping the baby on tummy position over her chest or over her tummy. This leads to development of a lot of neck control, hand control, and strengthening of the pelvic muscle happen, which is very important in walking activity. The third thing that's super important to be done is in initial days, make sure to swaddle your baby properly. What is swaddling? Swaddling is basically covering your baby in a way where his body is staying as if he was in the womb. Now, I've mentioned these 3 points in all my previous videos related to cerebral palsy. The reason I mentioned this is because it's super important. Please do not ignore it and make sure to do this. Now, since you have done all these 3 things, now comes for the kids who are already grown up, are having conditions like spastic diplegia or cerebral palsy, in which the legs are typically impacted, where there is this crossing of the leg present and thus impacts the ability to walk. So what you can do? Now, there are few things that you can do in order to reduce the symptoms. But again, the principle stays the same. The sooner you start, better it is. The later you start, it would be more difficult or else even sometimes impossible for you to achieve independent walking. Hence, it's very important to focus on early intervention and giving more and more repetitions. So, what are those things? Most important thing is calf muscle stretching, foot muscle stretching, as well as the hamstring muscle stretching. Make sure you stretch the leg of the baby whenever you start exercising for him. This stretch should last for 30 seconds and should be done for 3 repetitions. Apart from that, you need to also stretch the inner thigh muscles. This you can do by splitting the legs apart or else by bending the knee and then moving both the legs opposite to each other. When you do this, this muscle gets stretched out and thus helps in reducing the tightness. The second thing that's super important in reducing the level of spasticity and tightness is the help of massage therapy. Now, massages are good, but when the massage is done in wrong direction and in wrong way, it can turn harmful. So make sure whenever you're massaging your baby, all the strokes should go towards the leg. It shouldn't be down. The second thing that you need to take care while you're massaging the baby is do not do a lot of forceful activity. At the same time, don't be too light. The pressure should be firm enough that it touches the muscles of the baby. Remember, before you start doing any sort of massage therapy at home, take the help of a professional in understanding and learning the right massaging technique for the child. Massage are super good for relaxation and also helps in reducing the spasticity. Now, why it is important to reduce the spasticity is because spasticity is the biggest cause due to which it becomes difficult for the baby to walk. Hence, if you want to make sure that your child is able to walk independently, you should typically focus on reducing the level of spasticity. Now, when I say about reducing the level of spasticity apart from physiotherapy, there are a few methods that can help in reducing the spasticity level. And one of that method is about the Botox therapy. Botox therapy or as botulinum injections are helpful to bring temporary reduction in the spasticity level. Usually the effect of this Botox injection lasts for somewhere around 6 months and then gradually weans away. But this 6 months can be well utilized to stretch the muscles well, to strengthen the muscles well, so that overall ability of the child is increased. This is a long-term process and is a collaborative process. You need a good involvement of a neurologist, your physiotherapist, as well as the parents. When we all three become a team together and work towards the goal, the end goal, that is of making your child walk, it becomes possible. Now, many a times with kids who have got severe spasticity, severe contractures, at that time Botox might not work, and that is the right time when the surgical intervention is recommended. In surgeries, the aim is to increase the length of the tight muscles or the muscle that has gone under contracture, leading to deformities. Hence, it's very important here also to identify the age of the child, identify the ability of the child, identify the spasticity level of the child, then figuring out and coming up with a good surgical treatment plan, which is again followed by physiotherapy rehabilitation. This is also a team approach. Now, moving to the next thing that is super important in teaching your child walk, and that is practice. Now, many a times I've seen parents, they just go for 1 or 2 hours of physiotherapy session and they just leave, or else are unable to ensure that the positioning is maintained well at home. In my previous video also I've mentioned positioning is super important in order to get better outcomes. If a child is maintaining a wrong posture or else wrong positions, this might impact all the benefits that child has achieved through a therapy session. It's okay to not do exercises more at home, but it's not at all okay to allow your child to sit in a wrong posture. Always, as a parent, it's your responsibility to monitor your child and see that your child is sitting comfortably at the same time in the right aligned posture. This has a direct correlation with the ability of the child to walk and stand. If your baby's body is not aligned well, he won't be able to walk anytime. Hence, positioning is super important. Now, after positioning comes the activities. What are the activities that you can do to encourage independent standing and independent walking? So I would suggest first start with standing practice. Just imagine if you are not able to stand properly at one place, how the hell you would be able to walk? So the goal of parent at first place should be developing independent standing ability. How you develop that? Take the help of standing frame. You can take the help of some supportive area in the room or anywhere where the child can stand independently without your support. Ensure that the body is maintaining well aligned posture, the hands are free to move, and the legs are also well placed. That brings me to the next point. Whenever your child is undergoing the training of standing and walking, he needs some extra devices, also called as orthosis. Most commonly used orthosis is ankle foot orthosis, but similarly knee ankle foot orthosis, hip knee ankle foot orthosis are equally important in order to make your child walk independently. So that was about standing. Now, how to train walking to your baby? So again, it starts with baby steps. That is, first we need to teach the ability to shift weight from sitting to standing. Hence, the first activity that you should do for your child is sit to stand activity. Make sure you give some good support to your child, or else give hand to your child and encourage your child to do sit to stand from a small stool. This will help your child to develop that rhythm in hip and knee joint as well as the ankle joint, which is lacking in cerebral palsy. Once you have done the practice of sit to stand activity, also make sure that you encourage weight shifting exercise. So what is a weight shifting exercise? For example, if your child is standing with legs apart, then you need to ensure that the child shifts weight from one side to other side. Now, if you're going to any advanced physiotherapy center, they have tilt board standing trainers where there is unstable base of support, but for that you need to go for a center. But at home, it's very simple. Just make sure that your child is standing with little bit of gap. Keep some object in front of the child and encourage the child to reach out to that object and pick up that object. That is the best way that you can help your child to reach out to the object at the same time to develop that weight shifting activity. So as you do this for side to side, similarly you need to do this for front and back, which means you need to make sure that one leg of the child is front, the another leg of the child is behind. Then giving some object in front, encourage your child to come forward and catch that object. Come forward and catch that object. Then you need to shift the leg and then again keep an object in front and encourage the child to come forward and catch the object. Come forward and catch the object. So this is a simple but a very effective activity to encourage the walking transition. The next activity is marching in place. You need to give some support to your child during this movement, but by keeping some good support in the pelvic region, then encourage the child to lift one leg up and then down, one leg up and then down. This movement also helps the child to develop the ability to shift the weight. Once he has done this, then he needs to learn to step forward and then step backward. So this is also an activity where you need to give some support, but gradually you can train your child to do it himself. So step front and step back. Similarly, you can also practice side walking, which means moving from one side to another side. This is also a very simple but a very effective activity. And the last activity to encourage walking in your child is actual walking practice with the help of walker. Walker is very important since it gives that additional support to your child, maintains your child in a right position, right aligned position, and then allows the child to move. Make sure whenever the child is walking and if he walks on the toes, he should wear ankle foot orthosis in order to prevent further toeing and crossing of the leg. You need to also constantly give this command to your child that don't let your legs cross, because if he crosses the legs, he won't be able to walk. As your child will grow, he will understand the meaning of all these terms and would be good cooperative kid and will allow you to do these movements. Remember, cerebral palsy, unfortunately, is a very long-term condition. You won't expect complete recovery. You won't expect fast recovery. It will take years for you to see changes. But that doesn't mean that you give up, because there's a concept called as neuroplasticity, which means our brain has the ability to adapt to certain different kinds of environments, certain different kinds of abilities, and then he also has the ability to grow the powers in that area, which means if one side of brain is affected, the other areas of brain will become very strong and will overtake this weaker side. Same principle applies in our body. So friends, this was a small video trying to explain you and help you understand on how to train on walking the child suffering from cerebral palsy. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and just do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.